Greenwich Hub for Influence, Voice and Engagement, known as G-HIVE, is improving the joint working between the statutory and voluntary sectors within the Royal Borough of Greenwich. Through improving collaboration across the health and social care system, we are aiming to address deep-rooted health inequalities across the borough, with it being envisioned that increased collaboration and better partnership working means that voluntary sector organisations and communities can better engage with and influence local services, projects, programmes and activities. G-HIVE is delivering our aims and ambitions through a range of methodologies including networking events, conferences, training and learning opportunities. We also provide advice and guidance to the statutory sector around collaboration, consultation and engagement, as well as supporting the voluntary sector around their voice, influence and representation needs in terms of them engaging with the statutory sector on what they are delivering across the system of health and social care.
I work in the NHS and a part of it called Integrated Care Board to improve services, but in a way that we do it with all parts of the system and we do it with the people who use the services.
I'm the Chief Executive of Voluntary Sector Greenwich, which is the lead agency on volunteering in the borough.
I've been with the council now 18 months, trying to bring to the council a community engagement kind of service and the development of its first ever community engagement framework, which is now called the Community Engagement Pledge.
I got involved with G-HIVE by coming originally to an event.
I needed a way to network with everybody, to meet everybody.
And it was a really interesting opportunity to meet local people and to network.
I think with COVID, we lost that ability to network with key partners and organisations in the borough, and G-HIVE has brought really the sector back together.
I think the benefit from coming to the events and trainings is many things. I guess obviously if it's training, it's whatever the training is about and benefiting from increasing your knowledge and your skills and practising that in the room.
Through COVID, the Volunteer Centre's been involved a lot in emergency planning and joined the voluntary sector with their provision of what they do on emergency planning with what the council do, rather than us doing it separately. I think what G-HIVE has provided is to give me a platform to voice the importance of how the voluntary sector should be involved in emergency planning.
We needed again to bring the sector together, to have a discussion about how the community engagement framework would work in reality, operationally with them. And I think the response was because of G-HIVE and the relationship that had already been established in the sector.
So I think the advice and guidance from the G-HIVE team has been of benefit because it's helped us to think really deeply about how do we actually work with people in practice. You know, we can't change things on our own and we know that, but understanding how to do that work better in practice has been the biggest benefit.
We've definitely benefited, I think, from the expertise of the staff team within that, with expertise on emergency planning, which has been useful for this particular work for Voluntary Sector Greenwich.
There's nothing better than having good, working, useful relationships, building trust with the sector between the council, with our residents, with our clients and service users, and the voluntary sector organisations that are all part of the network of G-HIVE organisations.
I can't imagine a future without G-HIVE. I think that if we didn't have G-HIVE, we wouldn't have these fantastic networking opportunities.
So the next kind of evolution of G-HIVE for me is to continue the network, to have that grow and flourish and thrive.
So that you're a massive part of how we do what we do through your advice and your guidance and your training. You're fundamental, you're critical to the role that we all have in this system. That's what I hope for.
So G-HIVE has delivered some amazing work with some fantastic stakeholders across the Royal Borough of Greenwich, but we're not done yet. We will continue to co-create, co-develop, co-produce and co-design across the health and social care system to ensure we are addressing health inequalities once and for all.